So if you take the top off this model, you can see the parts in more detail. We should use these more in the office because it's very hard to explain the parts of the eye with a flat picture. It doesn't really make sense because it's a three-dimensional thing. I'll go from the front to the back like we did in this discussion and also with the diseases, and we can go through each part. So the first part is the cornea. This is this clear part at the very front. It's the first thing that the light would touch as it goes to the back of the eye. This is the front of the eye, this is the back of the eye over here. So you have cornea. I'm taking them out as I go, but usually they're all in place. Then the iris is behind the cornea. That's the colored part of the eye. That's what gives people blue eyes versus brown eyes. And then behind that is the lens, this piece. So this is what's affected in cataracts. It's not, sometimes we hear people when we talk to them about cataract surgery saying, oh, so you're gonna clean the eye or clean my eye to clear it off. And while like I understand where they're coming from, it's not really what we do. Usually in cataract surgery, we'll remove this lens. This lens would be like brown, gray, brown. We remove it and put in a new plastic lens. So it's crystal clear and the light can go directly through to the back of the eye. Behind these three, this is kind of a hard concept to understand too, even for some ophthalmologists in training, but this is the vitreous, this big ball. This is like a jelly that sits inside the eye to give it shape. This is only important for you all to know that this is kind of where floaters come from. It's changes in this gel. And then if you take all of that out, what you're left with is the retina, the wallpaper of the eye. The inside of the eye, this is what's affected by diabetes, high blood pressure, and macular degeneration. And then there's also the nerve. The nerve is at the very back. This is what's affected in glaucoma. So those are the parts of the eye. It's just important to have like a general understanding. You don't need to know it in super high detail, but it helps to kind of conceptualize, like when people say they're gonna do some sort of surgery or some sort of procedure or some sort of injection, to know like what they're talking about, what they're gonna do. And we try to relay that to patients that we're talking to in the office, but it helps to have some background knowledge too. So when you talk to your friends or a doctor's talking to you, you know enough about it to ask good questions and understand kind of what's going on.